Welcome back to Healthier Business, protecting the physical and financial health of businesses with the new normal of COVID-19. This, of course, is a series that we're doing, a webinar sponsored by the PhD Retirement Consulting, as well as the Better Business Bureau of Greater Kansas City. This is the third part in the series. The first two parts contain some other faces that you might see here on the screen, but they're not actually with us today. With us today is Dr. Ryan Jacobson, the Medical Director of Johnson County. He is medical director here for the county right here in the metropolitan area of Greater Kansas City. And he is giving us an idea of what things look like and what we can expect when it comes to Middle America. So thank you so much, Ryan, for your time today. Thanks for joining us. We've got several questions that people are curious about. This second session that we're doing has to do with kind of protecting yourself, cleaning, transfer of the virus, things like that. So the very first question is, how much safer is wearing gloves? Maybe it's an obvious, yeah, of course it's safe, but I've also heard that it's not transferred through skin, so you can't just touch the virus and have it come into your skin somehow. So is it really healthier wearing gloves? And is there this fear of cross-contamination, like if you're wearing gloves to the store and then you accidentally touch your wallet or touch your phone? I mean, how would you respond to that?
Yeah, I think there's a lot of confusion around wearing gloves in public. In general, I would say wearing gloves in public is not helpful and maybe actually detrimental. The reason you don't see the CDC and public health agencies advising about gloves in public is because it's really not helping reduce the spread. On the converse, it may actually be increasing the spread of disease by transferring what you feel like an invincibility of having your hands covered and therefore not performing good hygiene. Hand hygiene. If I put gloves on before I go into the grocery store, I have a sense of invincibility about that I can touch whatever I want with impunity. So my hands underneath the gloves are not touching anything, but the glove surface now becomes my new hand. And so I open and touch everything. I touch all the stuff without any concern all throughout the store. Now you can imagine if everybody does that same thing, that's essentially like saying no one is washing their hands at all as they're out in public. So when you see things like that, that's somewhat distressing in the sense that we want people to do good hand hygiene frequently. And simple soap and water, washing well, and or alcohol gels work absolutely incredibly well to mitigate the risk of touching things. So if you don't wear gloves, you can be just fine as long as you're not also touching your face, touching your eyes, or touching your nose or your mouth. That's how it's spread. So just by touching things, and as long as you're not touching your face frequently, there's much, much reduced risk and very little concern. You can't get it by touching through the skin. So glove wearing is something that I kind of discourage, and this should be done for one event. If I'm going to care for someone who's sick in a healthcare environment, I put on a pair of gloves, I take care of them, I take them off, and I wash my hands. It's a one purpose use. Wearing them in general for public is generally not a good idea.
I'm glad someone asked that question because I learn something every time I talk to you, but I would not have thought that would be a bad idea to wear gloves. But it makes sense. We're practicing good hand hygiene. Most are not practicing good glove hygiene. They're not washing their gloves, right? Exactly. What about masks? What about the masks that people are wearing in public? Should that be done? Is there a right or wrong way to do that?
So that's an interesting debate that has been recently updated by the CDC to recommend that even when people who aren't sick or in healthcare, when they're out in public, to wear some sort of face covering. Now, making homemade masks is a bit of a challenging task. There's a lot of different YouTubes and different memes out there about how to craft these on your own using different materials. In general, wearing a mask is being encouraged only to protect others around you, not necessarily to protect yourself. So we do know that there's something called asymptomatic or pre-symptomatic transmission of this disease, meaning you've got it. You could be shedding the virus during your conversations, talking, when you're in close proximity to people and not realizing you're sharing that virus with someone. So putting some sort of barrier over your mouth, such as a mask, is what they're recommending to help reduce the large droplets or just typical particles that would carry that transmission, that virus, and it would reduce this. Now, generally the guidance is that if you hold up the cloth to the light and you can see through it, that's less effective than if you can hold it up through the light and you see a little to no light coming through as far as barrier protection. So that's one kind of homemade thing that you can look at as far as if you're crafting your own. However, there are a number of vendors now providing cloth masks and things that can be worn. We're encouraging people not to wear surgical masks like in the hospital, because those should be reserved for healthcare providers that are fit for that purpose. But in general, it's not a bad idea to wear those just to help protect those around you from potential asymptomatic spread. And that guidance changes pretty frequently recently.
Yeah, well, you're right. It does keep changing. It kind of went from only those who are maybe sick should wear those to they almost, I thought, said everybody should wear them. It's interesting. You almost have to follow the guidance continues to change. What about the transfer on pets? Now, this is an interesting question that came to us. The Bronx, there was a Bronx Zoo tiger that tested positive. I don't even know where they keep talking about a shortage of tests, but for some reason they had an extra one to test a tiger at the zoo. It's kind of interesting. But if you're walking your dog and then someone pets the dog who's sick, and does it transfer on the fur back to you? I mean, can it actually, I don't think pets are getting sick, right? But it can transfer the virus to us through our pets?
So there is some evidence that shows that pets can obviously carry COVID. That is a zoonotic infection, and that there is capability of harboring that in pets. However, we do not think that is a source of a significant amount of infection in the community or in this country. We're not seeing that as the overarching concern. All we do is, if you pet somebody's dog, washing your hands or alcohol gelling your hands fixes that, any concern that you would ever have. So we're not concerned about pet transmission to humans in the United States right now as a major source of this type of a problem. I would definitely not be overly concerned about that.
Okay. Someone asked a question about UV lights, and I don't even know what that means. Are UV lights are supposed to help?
Yeah, so there's been some studies out of academic institutions that have looked at UV light for decontamination. For disinfecting masks, the respirator masks that we use. UV light can be used through appropriate, not just no homemade devices. UV light we are using here in the county, and hospitals in the region are using UV light to disinfect our respirator masks that we use after patient encounters so that we can continue to use them.
Interesting. Well,